As always, we are delighted to welcome Michael Hill with us this morning to moderate today's session. Mike, good morning.
Good morning, Jody. How are you?
I'm great, thanks. Good to have you back.
I'm glad to be back. And as much as I enjoy these settings, I'm anxious to hear what comes from the chamber for the fall season. And maybe this will be our last virtual Capital Connections.
That is our hope as well. Looking forward to having people back with us in person in the fall.
Awesome. Well, let's kick this off. We have a number of folks with us that have to cut off at different points throughout our meeting this morning. So we want to get things going. And I'd like to introduce a new face to this group this morning. We have Melissa Fish, who's the regional liaison for Governor Whitmer, with us this morning, a new face to the group, and I'm glad that you could join us, Melissa. I'd like to turn it over to you to give you 4 or 5 minutes to update us on your role and also some updates from the governor's office.
Fantastic. Thanks so much for having me here this morning. It's really nice to meet all of you in this virtual format. I'm also looking forward to seeing everyone in person, hopefully in the fall. That would be fantastic. As Mike said, my name is Melissa Fish, and I am the new regional liaison for Governor Whitmer for West and Southwest Michigan. I cover 22 counties, so it's like Berrien up to Ludington, Newaygo County, Montcalm, Mecosta, all the way back down to Branch County. I live in Kalamazoo, and so I'm kind of in the middle of the district a little bit. It's really a pleasure to be here. Prior to this role, I was a legislative aide for State Representative John Holdley in Kalamazoo. A lot of my work centered on constituent services, so making sure folks had access to state government and trying to help to break down any barriers folks may have accessing different services or programs or anything that they might need from us. And so I think that role really set me up for some good success in this role. And so I look forward to connecting with all of you. I'll make sure that I drop my contact info in the chat so you can all save that. I'll put my cell phone number and my email. So feel free to call, send me a text. Whatever it might be, and I'd be happy to chat with you about, whatever it is that you're working on. And I'd be happy to, if you want to sit down for coffee, I'd love that too. I'm really just working hard to meet as many folks as I can throughout the district. So if there are folks, that I should be meeting with, please let me know. And I will add them to my ever-growing list of folks that I'm making connections with. So I'm really happy to be here today. I just wanted to provide a few updates from Governor Whitmer's team. She's been laying out a lot of proposals lately, especially with the surplus in the state budget and with all of the federal dollars that are coming in. This is really a huge opportunity that we have to make some really big changes in our state and some really huge investments we can make that would be really beneficial to a lot of folks in our lives. And so, the first one I wanted to mention was she laid out a proposal for $455 million to expand the Great Start Readiness Program. So this would cover things like increasing the eligibility rate for families to be able to participate in that program. So we would have more 4-year-olds who are eligible to participate. It would also increase, there are some pieces in there to help increase the number of classrooms that we have, because we know it's really great to increase the number of kids that are eligible, but we also need a place to put them. And so we want to make sure that we're being thoughtful in those with that investment to make sure that we have a place for those children to go. And plus it'll support other things, like we know that GSRP teachers, need raises. And so there's some pieces in there to help increase some wages as well. Another proposal that's been laid out as part of the Economic Jumpstart Plan is the My Bigger Paychecks program, which would help businesses increase wages to $15 an hour. She's also laid out a proposal for expanding the work-share program. Some of that could include, using that $300 a week that people are getting from unemployment, so as like a bonus for returning back to work, and so they could continue to receive that benefit. So that way that, there's more of an incentive to return to work, because we know that we need that. There has also been this Michigan Main Street initiative, which would invest $300 million in small businesses. A good portion of that money would be dedicated to, the restaurant industry, because we know that is an industry that has been very much impacted by the pandemic. And then the last piece that I'll talk about is childcare, right? We know that for folks to be able to go back to work, we need more childcare available, and we need to make it more affordable for folks. So the proposal for childcare would increase eligibility rates for families, and then it would also provide rate increases to providers, and they could use that in a lot of different ways, including raising wages for childcare workers, because we know that they're some of the lowest paid folks that we have. And so those are just a couple of the things that she's been talking about. There will continue to be lots more information coming out. But like I said, it's a pleasure to meet all of you. I'll make sure I drop my info in the chat. And I'm one of those folks that has to jump early, so I really apologize for that. If you have any questions, don't hesitate to follow up with me via email, call me, text me, whatever it might be. Thank you so much.
Hey, thank you, Melissa. We appreciate you being with us, and we can't let you go without finding out the name of your furry friend that was just joining us this morning too.
Yeah, so I'm joined by a whole host of them. So that was my cat, Damien. But behind me on the bed, you can probably see, is my dog, Sandy. And then his sister is on the floor. Her name's Aria. And I tried to kick them out before the meeting, but they refused, and they were like pawing at the door. So
well, we all know how that goes. So appreciate you sharing your family with us, and thanks for joining us. We look forward to meeting you in person in the fall.
Thank you so much.
All right, so we're going to turn it over to our state legislators now. And just as a recap for everyone with us this morning, there were 5 topics we asked our legislators to be prepared to talk to us about. One is just an update on redistricting. So you may be aware that the Voters Not Politicians group that changed the way that Michigan redistricts is really kind of going into full swing now. So looking for an update on that. Looking for an update on auto insurance reform. You may have thought this was something that was kind of over and done with last year or 2 years ago even. But some of the impacts of the legislation that was passed 2 years ago are going into effect July 1st. Michigan's auto insurance platform didn't really have a fee schedule in the past, meaning basically it paid whatever was charged. And a fee schedule is going into effect July 1st, which is cutting some reimbursement rates to home healthcare workers and long-term care providers by up to 45%. And so want to get an update on that. Tri-Share Childcare Program is one of the programs that our friends in Lansing are working on to try to increase the accessibility to childcare to get people back to work. An update on the state budget, and then finally, as Melissa mentioned, there's a substantial amount of federal funds that have come our way as a result of the COVID bailouts, and interested on how the state legislators are planning to spend those dollars. So we are fortunate to have Senator Eric Nesbitt with us this morning. We also have Representatives Mary Whiteford, Jim Lilly, Brad Slaw, and Luke Meerman with us. And I know that Senator Nesbitt has to jump for a radio spot at 9:30. So Senator Nesbitt, if you could come back on, we'll start with you and get an update on those 5 topics.
Hear me fine? Can you hear me fine?
We can. Yep. Go ahead, Senator.
Okay. Yeah. Thanks. Thanks for having me on. It's good to see folks again. Sorry for the double booking and one of my the road days, but it's good to be back and look forward to actually being back in person to have those one-on-one conversations. But I'm going to start with what you mentioned with the Citizens Redistricting Commission. There's 2 opportunities here in West Michigan for folks to participate, and it's something where I would encourage folks to participate in the Redistricting Commission. They have 16 events around the state, and there'll be one on the 29th in Muskegon. I believe that's at Van Dyke Center, and then one on July 1st in the evening at 6 p.m. at the DeVos place. And so either of those, you can go ahead and pre-register. I believe you just go michigan-mapping.org. You can, and those that want to sign up, I'd encourage anybody there, whether business leaders or local elected officials or other ones, to talk about what those communities of interest looks like. 2, a little bit on the Michigan's auto insurance reforms. You're right, the second phase of the implementation is going into effect July 1st. Again, we had a one-size-fit-all auto insurance policy in Michigan for nearly 50 years, since the early 70s. And the reforms that were passed 2 years ago involved providing choice in the levels of coverage that people can get, stopping some of the price gouging that's been going on in the medical sector, limit some of the lawsuit abuse that's been going on, and creating this fraud authority. Some of the stuff that you mentioned in terms of conversations is that over the last year, we've seen actually no-fault reform is working, even though we still have some of the most generous benefits. We do have the most generous benefits in the nation in terms of reimbursement. It's lowering rates for Michiganders across the board. Last year, Michigan's auto insurance rates dropped about 27%. Michigan's no longer the most expensive state in the nation. We were the most expensive state in the nation for years. And because of these reforms and providing choice and having different options, we've actually have 50,000 new drivers so far that have purchased auto insurance for the first time or for the first time in several years because they can now afford it. Unfortunately, not all providers, I think, are being straightforward about how no-fault reform is going to be impacting them. I've been sitting down and trying to have conversations with them, as you mentioned, is that the hospital settings or doctor settings have a Medicare reimbursement rate. And then on the long-term care has for those that don't have Medicare reimbursement rate, there's a percentage of what their full charge master was from a few years ago, and then that also has allowed for a CPI increase that'll go on, so there will be inflationary increases. But those who are receiving care before passage of these reforms will continue to receive care, and some providers have already expressed their intention to reorganize and trying, and ensuring that folks have the coverage that they've come to expect. So I'm continuing to monitor that and working on that. In terms of the budget, you're right. Last month, the Consensus Revenue Estimating Conference, this is a biannual event where the state treasurer, Senate Fiscal Agency, House Fiscal Agency, economists from University of Michigan, Michigan State University get together, give a best estimate on where the budget's coming. Saw that there was billions of more taxes coming in from taxpayers than what was expected just from back in January. And then the amount of federal monies that are coming in also. And we're working to try to figure, what's best to prioritize. And I think instead of just growing the size and scope of government through a permanent expansion that we see some are pushing for, that I think it's important instead, if there's this kind of one-time money, either from locally, either from the state taxpayers or our children or grandchildren through borrowed funds at the federal level, that it should go into real infrastructure. And that's why you saw Senate Republicans a few weeks ago introduce a bridge program where $1.5 billion would go in to fix every critical bridge in the state. You just saw recently we dropped a $2.5 billion package involving water, wastewater, and also dam upgrades to try to make sure that we have these pieces of infrastructure taken care of. And so those are a few of the areas that I think are important to prioritize after we make sure that, the testing, vaccine rollout, the healthcare sector's taken care of. So that's a little update on my end. Appreciate the time. There's a bunch of other stuff I can go into, but I know there will be some good updates from other legislators.
Senator Nesbitt, while we still have you on the line, we did have a pre-submitted question specifically for you as well. So wanted to get your feedback on it before we open it up to the other representatives. And the question is specifically related to short-term rentals and legislation that's in the House and Senate currently. And the question primarily is around the lines of, is short-term rentals something that should be handled at the state level from your perspective, or do you think that letting it be more of a local control issue is the better way to go?
I think it's actually a combination. I think providing, I introduced a bill that will provide a definition on what short-term rentals are, and that passed out of committee a few weeks ago. It's now being considered on the floor. Same in the House, and I do think that there's importance for a statewide clarification on what short-term rentals are and approved residential use of property. And I do think that locals shouldn't be able to just zone them out of existence. But I do believe the locals should have control and authority, and the legislation's been introduced to go into whether it's to allow them to regulate things such as nuisance, things like noise, parking, how many people are staying in the house, registration, licensing, et cetera. And so I do think that there is something where at the statewide level that we can protect individual property rights, and at the local level to be able to allow appropriate regulations applied on a consistent basis, such as on noise, advertising, traffic, or other conditions to prevent nuisances. So that's a little background on that.
Awesome. Thank you very much, Senator Nesbitt. Representative Whiteford, I'll turn it over to you to offer some insight on the topics that we've brought up already.
Thank you, Mike. Good morning, everybody. I'm going to talk, just touch on the auto insurance really briefly, because I had one of my constituents make some statements about her perspective on what I thought. The one thing that I found, me and my family, we insure 7 vehicles. We save 50% on our rates. And that's because we have an umbrella policy. And of course, our agent didn't want us to do that because they get paid based on their total, the total amount of money coming in for those policies. So that was really huge to me. And then the other thing, I had conversations with that person's home care company, and that person said he couldn't believe all these companies out there are doing these scare tactics. He's not going to abandon his client. That 55% decrease in rates wasn't to the person taking care of this woman, because she's like, oh, this person's only making $14 an hour. You're going to drop that by 55%? No, that's not what it is. The problem that we have is that many companies, the home care companies, aren't telling us what their original rates are. And so that's very unclear. If we knew what that was, we knew what the 55% decrease was, then that would be a little more clear and honest with the public. So my goal is to make sure that this woman and other people like her do get the care that they need in their homes, and that the people taking care of them, which have the biggest impact, those direct care workers, are getting paid properly. When it comes to the budget, it's a lot of money, right? But that money isn't in the bank right now. So I consider this basically a bond, right? We're bonding from my great-grandchildren's future. So whatever money that we spend, I want them to feel the impact. I don't want any short-term decisions. That $15 an hour uplift for 3 months and let the market figure it out is so disingenuous, and that's not wise. So my part and my addition to the whole house package was investments in behavioral health. So what that means, we have a children's psychiatric facility over in Oakland County, and it's really in bad shape. Why don't we use this money to build a new facility, a new hospital, to take care of these poor kids who are out there just languishing in their homes, in emergency rooms? And let's go and make sure that we start implementing crisis stabilization units. Governor Whitmer signed that bill into law that I sponsored. And what this is people don't have to go to emergency rooms once we start establishing these CSUs. They can walk through the door and start getting help within 24 hours. It's decided, does that person need a longer stay? Let's start that process. And then most people can be stabilized in 72 hours and then have that warm handoff to help somebody who can help them. And that's implementing the Michigan Crisis and Access Line also. That was a bill. It took me 3 years to get signed into law. It's currently in Oakland County and the UP. Over 9,500 calls came in the first 2 months that it was in operation. So that's been really helpful. But we also are trying to designate $100 million to establish pediatric psychiatric beds in hospitals all over the state. I had parents come and testify how their child was in an emergency room for 2 weeks, not getting the care that he needed. And so I got involved, worked with the department, and got that child into a psychiatric bed. But this is so real, and it's so harmful to our children. So let's take the big picture look on how we're investing this money. And let's make sure that like I said, our grandchildren, great grandchildren are able to benefit from these funds that aren't in the bank right now. So what I'm hoping is that we come to an agreement, everybody's sitting at the table, make those good decisions for the state of Michigan on that supplemental, so all those federal funds, and then let's make some good decisions for this next budget that starts October 1st. So I share almost half the state budget. It's gone from about $26 billion, and I see it going over $30 billion this time around. But even that, I want to make sure that that's sustainable. It's something that we can count on year after year. And if there's funds in there that aren't going to be there every single year, well, let's use it to have long-term decision making instead of just counting on that money year after year. And I think that's the most respectful to Michigan businesses, Michigan taxpayers, who, they work really hard for us to have this money that we have it's a supreme obligation that we have right now as appropriators to do this right. And I'm working with my colleagues and in the House and Senate to do this. So I'll let everybody else touch on other subjects, but thanks, Mike.
Thank you, Representative Whiteford. Representative Lilly, just a couple maybe clarifying questions or dive in a little bit more deeply. I recently heard that Representative Albert shared with us, Thomas Albert, that these federal funds don't all have to be allocated and or spent until 2026 to some degree. So we don't have to rush through this and spend this now. Is that accurate as far as you understand?
It is. I mean, obviously there's different, buckets to all of these funds, but that is very true. They don't all need to be, it's not a use it or lose it, in this fiscal year situation. We did recently as a House, go through the appropriations process for some of the money that did sort of need to get out the door, and that's now done. So we've got time to be a little bit more deliberative about what's left.
Perfect. And then are you in a position to talk a little bit about this pilot program, the Tri-Share childcare pilot program that's underway right now?
So honestly, Mike, I can share a little bit about what I know, but it's very, very high level. So obviously, that sort of partnership between, the employee, the employer, and the state, it makes sense when it comes to childcare because there's public good associated with this where, as we're trying to get people back to work, childcare is going to be a major sort of stumbling block as it relates to that. And so I think we're fortunate in that we have a period of time here where it seems like the governor and the House and the Senate to some extent are interested in making a pretty significant investment in childcare. So Representative Workham up in Muskegon, who's not on this call, is really kind of the point person in the House on this, to my knowledge. And so, we've been working with a lot of business leaders here in West Michigan and Grand Rapids to get the pilot program off the ground. And I think it's a pilot program with Goodwill Industries of West Michigan. But beyond that, I'm not super well versed in the policy, but I guess what I would just comment on is from a political perspective, I think this has been an issue that maybe, hasn't been super bipartisan in the past. And I think it appears as though at least the landscape is such right now that this could be a pretty bipartisan issue that we could see some movement on.
And just in summary, that the program logically is employers will pay a third of childcare for employees' childcare needs, the state will, and then the employee will contribute a third of the cost as well. Is that correct?
That's my understanding. But again, that's sort of just from the title of the program, the Tri-Share thing. Honestly, I'm not an expert on it. So
perfect. Do you have any other updates you care to share with us from your perspective, either on the federal funds, the budget, or redistricting?
Sure, not a whole lot in those areas. I'll hit on a few things. What I would talk about maybe is auto insurance reform, and I think you've heard it from Senator Nesbitt and Representative Whiteford. But in general here, transparency will be sort of the theme to any reforms that we're sort of contemplating. All of the reforms that we passed included some mandated cost rollbacks from the insurance perspective, and so we have to be careful as we start tinkering with any reforms going forward, to the extent that you change the amount that you're requiring insurance companies to pay out, you're probably going to have to allow them to flex in terms of how much money they're saving customers. And we recognize that there may be some challenges going forward. I think the majority of those challenges don't necessarily relate to the good actors. And so I think we can probably continue to work on a solution that's narrowly tailored to helping those that do have real costs associated with this, that do have costs that are competitive when we look at other states. And I think that's something that the House and Senate are probably willing to work on, but it probably will require some of these providers to open up their books and be pretty transparent about what the real issues are as it relates to their costs and what they're charging.
Representative Lilly, just to put a period on that conversation briefly, Medicaid, the state program for low-income individuals, has a fee schedule and doesn't pay exactly what the providers charge. Same thing with Medicare and commercial insurance, all negotiate to pay discounted rates. The one outlier was providers that were getting reimbursed from the catastrophic claims organization related with auto insurance. And so this fact that this is going into effect July 1st wasn't necessarily a surprise. We knew this has been coming for 2 years. And what the intent was, if I understand it correctly, 2 years ago, was just trying to put some cost containment features and not allow providers to charge whatever they want with no negotiation involved. Is that accurate?
It's very accurate. And again, it's mostly common sense reforms, Mike. One of the examples I always give, it seems like people can understand it, is, some people require 24/7 care as a result of some of these claims. They just do. The accidents are by nature catastrophic. And so one of the caps that we put in place was sort of, for related attendant care. This concept of, look, if you're a family member, you probably can't literally work 24 hours a day, 7 days a week to take care of somebody. And therefore, you shouldn't be being paid to do that. Now, you could work maybe, I can't remember what the cap is. I think it may be 50 or 55 hours or something like that. You could reasonably do that. And so, essentially what we say is not that the person can't be reimbursed for care beyond those capped hours, but just that it has to be done by somebody other than a related family member. And I think that makes sense when you think about it. Again, you can't literally work 24 hours a day, 7 days a week taking care of somebody. It's physically impossible. And so to put a cap on that, but then allow outside folks to sort of fill in those gaps seems pretty reasonable. And I think that's one of the examples of those reforms that make sense. Other things I might just hit on, they're not really on the list, but I'll just be brief. Regulation of Delta 8, which is essentially, it's not THC in cannabis, but it is something that basically behaves like THC. Essentially, we had a market in Michigan that was completely unregulated. Related to this, we're moving legislation to fix that in the Senate, and also providing some insurance coverage to entities that are engaged in selling cannabis, much like liquor law protects, dram shop law protects those that are selling this stuff unless they're selling to minors or those that are visibly intoxicated. Since things are legal in the state now as it relates to cannabis, we thought it was important to make sure that businesses could get insurance policies related to that. So those are two issues that I'm working on, but outside of the scope of the 5 that you're talking about. So I'll not elaborate on those unless there's questions.
Perfect. Thank you, Representative Lilly. Representative Slaw, who's got an audience there of grandchildren this morning. And if you wouldn't mind, Representative Slaw, just giving us an update on those topics that we've been touching on already.
So obviously you've had lots of other people speaking into this, so I'm probably not going to share lots of new stuff, but the interesting thing about redistricting is this whole communities of influence that we need to speak into that. And so if I would continue to encourage folks that are on this to look at those dates that were given, the 27th, I believe, or the 29th, and then July 1st. And get a chance to be there to see what's going on, to be speaking into what is a community of influence and how does that impact us? Is it our farming community? Is it our, what is it that defines our areas, and how should we be breaking community up to say these people should be voting in this group? So interesting stuff. The auto insurance reform, one of the really interesting things to me is that we had one of the lowest participation rates of insurers who were actually writing policies in the state of Michigan. I think we had like 40 different insurance companies who were writing insurance in the state of Michigan on auto. And we've already had, I think, 22 or 26 new companies file to be able to write insurance for our auto industry. Obviously, if we had that low of participation before, there was a concern in the way that we were getting stuff, and a concern of, are we getting the best rates because there's less competition? When you add that many more, we're going to see better competition, and we expect to see rates fall as part of that whole process. So I think that's going to be where some of the benefit comes to us over the time. State budget, I'd love to just chat about that for a second. One of the things that I think is really important is, could we look at doing baseline budgeting for the state rather than, I know there's some potential requests looking at by the Senate to extend beyond the July 1st deadline, which we self-imposed on ourselves a couple years ago, saying we really should have our budgets done by July 1. The Senate has, I believe, moved some legislation that we could extend it beyond that. My goal would truly be to not do that. How can we find a baseline budget, get everybody to agree on the baseline and say, okay, we're going to have a whole bunch of supplemental bills going forward to spend the rest of the money, because there are lots of dollars coming in both at a federal level, and our tax dollars we're going to see a bunch of tax dollars increased over this year, because people bought lots of solid, durable goods, and whenever you do that, you end up with more tax dollars. They didn't spend it on going out to eat because all the restaurants were closed, but obviously they spent it on other kinds of stuff. Their income they spent on other kinds of stuff. But baseline budgeting, I think, makes really good sense, and something that we really should look at to try and accomplish and get budgets out. Schools need to know what they're going to be able to spend, those kind of things. I'd love to be able to put that in place. You know, the federal funds, it's amazing the amount of dollars that are going to be in the state coming through this year. And so with those dollars, as Mary and Jim talked to, there are places where we can invest that for the long term. And I think that really is what we need to be thinking about, is how do we invest long-term dollars, not not increasing program sizes, but actually increasing the dollars that are used for future benefit. Because we are going to be spending, or we are going to be continuing to look at how do we get taxed for the money that we're giving out to everybody right now, and how is that going to work long term. And then I'll just let it go. We can ask questions and fill in from there.
Thank you very much, Representative Slaw. Representative Meerman, glad that you were able to join us this morning as well. And we'll turn it over to you to, if you have anything to add to the topics we've been talking about, or you can be the first one to kick it off and touch on a couple other topics that are front and center for you right now.
Well, thank you very much. Is the audio coming through all right?
It is, yep.
My apologies for being audio only, and also for showing up late, but thank you for this opportunity. I think I will leave the topics that have been talked about. They've been really quite well hashed over, and I think we just need to keep engaging to whatever extent we can, because they're very important topics. So I agree with much of what has been shared already. I'll just throw two things out there, and then we'll keep moving on and maybe get some questions. And that is JCAR, Joint Rules Administration Committee. That's the committee I chair. And we recently, the governor was proposing that MIOSHA have the ability at any time going forward in the future to decide when and how long masks need to be put on, among many other things. And the reason I bring that up is just because I think the voice of the people is tremendously important in this whole democratic process. And we just need to keep the legislators' voice in the picture. And so what JCAR does is watch the rules that are promulgated by the departments. And that was a rule that was, being proposed to be promulgated by the Department of MIOSHA, Health and Safety. So I just think it's tremendously important, frankly, that as departments propose their own rules, and which is a somewhat normal process, either through legislation that they need to, promulgate rules because the legislature, frankly, probably doesn't have the expertise to do it, or through every 5-year process, they want to update the rules. We just need to be very vigilant and observant about what those rules are and kind of what they're proposing, because we are the voice of the people as the legislature. And those rules obviously affect us all here in Michigan. So I'm grateful that we were able to stop that. And I'm not opposed to MIOSHA having that kind of authority. I just don't want an open-ended authority for MIOSHA. So, I'm looking for a timeline. I'm looking for a period of time. And then at that point, they need to come before the legislature or get some other input outside their department. And then I'll just throw out something maybe not many people are thinking about, but I'm kind of excited about it, and that is Central Registry. It is a list of people that CPS has decided are a danger to children. and I'm in favor of the list. I'm just not in favor of the size that the list is at currently. Close to 500,000 people in Michigan are on that list. And so myself and Representative LeGrand and Grand Rapids there have been working on it for quite a while now, frankly, since before COVID started. And I think it could be quite substantial for us to be able to pare that down to make sure that the people on there. So if you go to volunteer at school, if you want to work in your church nursery or many other places that are around children, this is the list that your name gets checked on. And again, I don't want to get rid of that list, but right now that list is only determined by the department who is on that list. It's not like the sex offender list where you have to be convicted of a crime. And so frankly, the department has also acknowledged that the list is too big. So I'm hopeful that you'll see legislation very soon introduced that could significantly change the size of that list and make sure that, to the best of our ability, only people who are truly a danger to children are on there. And I'll leave it at that and take questions.
Thank you very much, Representative Meerman. So we've got about 7 minutes or so left, and Representative Whiteford, I'm going to come back to you and ask you to touch on two topics and get some insight then from the other representatives as well. Number one, there was some legislation that was passed and signed into law allocating $4.4 billion to K through 12 education as part of the COVID bailout. And the dollars are intended to help students recover the learning loss that that occurred during COVID. Can you offer any sort of specifics on how someone would go, how a school district may implement those dollars to do that? It seems like a kind of a nebulous assignment. The other one is that on Thursday, the House passed some legislation that would eliminate the $300 federal kicker for unemployment bonus. And this is a employer-centric audience here, and many of them, if not all of them, are struggling to find workers. So there's a lot of pushback from the Democrat side about eliminating that bonus. So if you could touch on either one of those topics or both, that'd be great. And then we'll let the other representatives weigh in as well.
Well, I'll talk about the UIA issue. It's really hard when you give something or appropriate something that a family gets. It's when you take it away, then you're taking it away instead of, it's just an extra bit of money trying to help people in a hard time. When does it end? We hear over and over again, businesses can't open or they've got reduced hours because they can't get people to work for them. And, I get it. If you're a mom, you want to stay home with your child, or a dad, or if you're just getting this check, the money's coming in and you're making more money getting unemployment, staying home than going in work. I have a friend, she works at McDonald's in a drive-through. She's getting ready to retire in a couple of years. She told me, and she's never stopped working. She told me that she would rather work than get paid more from UIA because it helps her in the long term. But she knows there's so many people who just won't go and take those jobs. So it's so important for us to start phasing out, getting back to normal. People are healthy, people are vaccinated. We've got some good treatments for COVID now, and let's start moving forward.
Thank you very much for that. Representative Lilly, would you care to touch on either one of those topics?
Yeah, again, I think I would just touch on UIA and I echo, Representative Whiteford's comments. At the end of the day, we've got unemployment signs job wanted signs up all over the place. We've got significant issues in, hospitality industry and other industries have already been significantly adversely affected by COVID. This is certainly something the governor, should be looking to partner with us to tackle, and we're just not really seeing that sort of willingness or interest at this point. And so I hope that changes here over time.
Representative Slaw.
Yeah, I don't know that I'm going to be able to add much to that. I would agree with the things that we were just talking about. It is important for us to get people and get them into the workforce. So if we can use dollars to help encourage people to work rather than encourage people to stay home, I'm interested in using dollars in that format.
Representative Meerman, just to maybe put a little different spin on this, the governor has proposed that maybe as an alternative to eliminating the additional stipend for unemployment, keeping it out there, but giving it as a reward for going to work. Do you have any take on that? And do you see that as a valuable solution or compromise, or do you have any other thoughts on the way we could approach this?
Well, I think to Representative Lilly's point, at the end of the day, it's going to need to be a negotiation with the governor because it's kind of in her wheelhouse. It is in her wheelhouse. That money flows directly to our Michigan unemployment bypassing legislature. So we would need her signature. It's not that we can, kind of deny the money at the legislative level. I guess I would be willing to, think along a lot of different lines as long as we can make moves to getting rid of that. I think it's really hurting us right now. Unemployment should be there for when you can't find work. And I think there's a lot of work to be found out there. I am really cautious about rewarding, I guess, people that kind of haven't decided to go back to work when they could have. Because, as Representative Tommy Brand says, he's had, workers throughout this pandemic. And, suddenly someone's going to come in and start working at Tommy Brand's restaurant, for instance, and be getting unemployment also. If it's part of a whole package that we could, move beyond this and get people back to work, great. Otherwise, I'm cautious.
Thank you for your insight on that. So we have just about 2-3 minutes left. And so, does anybody else have anything they want to add in? And just to set this up, maybe if you don't have something specific, Representative Whiteford, you did a great job saying that if we're going to spend these federal funds, let's do that on something that's going to be generational, whether it's fixing bridges or building a mental health facility. Do you have any other thoughts on how we may be able to allocate those dollars in a generational way?
I think it's important that we pay off debt to the best that we can. And that's a huge generational thing. Pay off these road bonds. There's a lot of opportunities and we're trying to be as creative as possible. And I really appreciate Chair Albert looking at those different ideas because if we're able to do that, we decrease our loan repayments year after year after year, which frees up general fund money to be able to do important things.
Perfect. Representative Lilly?
Yeah, I would just add, as much as I think it's important to pay off debt, I think we also have to think about the balance sheet in terms of the unfunded liabilities that we have here in our state, specifically as it relates to infrastructure. So again, I do think it's important to free up, cash flow in future years, but it's also important to actually catch up and make the appropriate investments in water infrastructure and in, transportation infrastructure that we've sort of put off doing for years, because the extent that we don't do that, those things are only going to get more and more expensive. And again, I fully support paying down debt, but I don't think you can do it at the expense of making the current investments that are needed to sort of catch up. And so that's the line that we'll have to walk.
Representative Slaw, anything you care to add to that?
I don't know that I've got things that I want to add necessarily to that, but I think the other piece, one of the other pieces that we're looking at as a legislator is the totality of elections and how do we continue to move in a place to make sure that those are done well. We're encouraging people to vote, we're actually helping them to do that, and we're ensuring that the integrity is there.
Thank you. And that was a topic we weren't able to get to, but when we reconvene in September, I'm sure we will be talking about legislation that the House and Senate are working on right now. Representative Meerman, we'll turn it to you for any last comments before I hand it back to Jody.
I just appreciate the opportunity to be here in this venue, and I would encourage business owners, anybody else, continue to reach out to us. Your voice is so important to kind of where our heads are at often, and the more we hear, the better able we are to advocate. So keep up that good work. Thank you.
Thank you very much. Jody, as always, you guys gave us great opportunities. And so you've done a great job pivoting in the midst of COVID, and I'm anxious to see you in person, hopefully this fall. I'll turn it back to you.
Thanks, Michael. And thank you as well to Senator Nesbitt and Representatives Whiteford, Lilly, Slaw, and Meerman for joining us this morning. It's great to get an insight to what's happening in Lansing. And with that, I'll say thanks for joining us this morning and look forward to seeing you again in the fall. Thanks, everybody.